Hello, I'm Bob Garvin. Welcome to Body Talk, episode 81. Most knee surgeries are not needed, says a new study backed up by my expert opinion. Warts can be cured by hypnotherapy. Hypnotherapist Darlene Corbett and Dr. Rebecca Johnston join me today to tell us how. And find out what new research says about the best way to stop the burning of spicy food. If you have any questions or comments about this podcast, send an email to lifestarmedia@gmail.com. Surgery is overdone and is not needed for most meniscal tears of the knee, says a new study out this week. A meniscal tear is a common knee injury affecting many people at some point in their lives. Meniscal tears occur with age or when damage is done to the rubbery discs that cushion the knee joint. This new research suggests that exercise works better than surgery to heal the condition in most middle-aged people. According to the European research team, about 2 million people undergo this surgery every year worldwide, although there's debate over how valuable these procedures are for meniscal tears. To help settle the matter, a team led by an orthopedic surgeon in Norway tracked the outcomes for 140 patients. These patients averaged 50 years of age and had meniscal tears. Half of the patients performed 2 or 3 supervised exercise sessions a week for 3 months, while the other half underwent arthroscopic or keyhole surgery followed by simple daily exercises. After 3 months, knee function and strength improved in the exercise group, but strength did not increase in the surgery group. Researchers say the findings suggest that exercise therapy, not surgery, should be considered for middle-aged patients with meniscal tears. Now, this is where I step in with my expert opinion. Exercise should not only be considered, it should be mandatory because it works, eliminating the need for most of these knee surgeries. I know because I've seen it firsthand many times over. I've trained hundreds of people for over 20,000 hours as a personal trainer over the last 12 years. My experience has shown me that the right kind of exercise keeps people away from the surgeon's knife. All of the people I've trained that came to me with knee problems have restored function of the knees and now live pain-free. Many of these people had surgery scheduled but canceled their surgeries after feeling the positive effects of functional exercise training. If you have knee pain and are told you have a meniscus tear that needs surgery, calmly walk away from that surgeon and find a personal trainer who is an expert at functional training. It's some of the best money you'll ever spend. The study proving that most of these knee surgeries are unnecessary, it was published in the British Medical Journal. Hypnotherapy can cure most warts and help with so many other issues and conditions. Joining me today to help explain is Dr. Rebecca Johnston, a health psychologist at the Center for Neuropsychology, Learning, and Behavioral Medicine at St. Joseph Hospital in Nashua, New Hampshire. She also has a private practice in the greater Boston area. Dr. Johnston has been using clinical hypnosis for over 20 years. Also joining me today is Darlene Corbett, a licensed independent clinical social worker and hypnotherapist. Darlene has been a partner with Needham Psychotherapy Associates for over 23 years. She is also a blogger for the Huffington Post. I want to begin by asking you both what someone can expect during their first hypnotherapy session.
I always do a standard psychological assessment of anyone coming in because I really need to know their medical history, need to know their psychological history, because I want to make sure that this is the appropriate technique for them. I also want to make sure that they are able to utilize it, and there are ways of interviewing people to get a sense of that. Did they daydream as kids? Can they fantasize? Do they experience highway hypnosis? Different experiences in life. When you're doing something really interesting, do you lose track of time? Is a typical question. Because you're in a spontaneous state of trance if you do. Artists and athletes are terrific at self-hypnosis because they get so absorbed. All the crowd, if an athlete who is performing in a baseball stadium was distracted by all the screaming people, they couldn't do their job. They have to learn to screen it out. So in terms of what happens when you come in after the evaluation, I help people learn how to get deeply relaxed and focused. That's called an induction. And the goal is ultimately to help people pay more and more attention to certain aspects of their experience that can be relaxing, or scenes from the past where they felt terrific and really relaxed, like a great vacation. In that relaxed state, it's possible to help people deepen that sense of becoming immersed or involved in an internal scene or experience that's deeply, deeply calming, safe, and focused. And gradually people begin to lose track of what's going on around them, but they're always in control. Then we get to the work of what they want.
With nail biting, we often use what's called hypnoprojectives, and that's one way. You have somebody imagine someone like themselves, whether it be on a stage or on a TV screen, that used to bite their nails, or used to have an urge to bite their nails but has found healthy, effective ways to stop. Or you just have them, you promote them thinking about that they've outgrown their habit. But whatever during the working phase, that's the piece you really focus on, the problem solving, like nail biting. And then there's the closing, the termination stage, where you help them visualize seeing themselves at a different point, that they are ready, that their nails are growing, they no longer have that need, they've outgrown it. And there's different techniques, and you make post-hypnotic suggestions.
Then you actually bring people back to the normal waking state,
yes,
which is very important.
Yes.
Because people can sort of stay sort of in this sort of internal state unless you make sure that they're already back and they're processing their environment. And that's a really important safety. It's good clinically, but it's also important from a safety perspective. You don't want someone driving if they're still visualizing being somewhere else.
Now, do you ever have to turn someone away? Somebody comes to you and after evaluating you go, do you ever have to say, I don't think this is going to help you?
It happens rarely, but yes.
That's got to be tough.
It's very difficult. There can be a number of things that mean that it may not be the best and most effective tool. This is one of the things that's most helpful about explaining to people that hypnosis is one tool among many for psychotherapy. Because hypnosis may not help them get where they want to go, there are many other ways for them to get there.
What about physiological effects? I mean, could hypnosis lower blood pressure if someone's got elevated blood pressure?
I'll let you speak more to this, but I just find people get in such a relaxed state, they leave here. Obviously, I don't measure their blood pressure. She's a health psychologist, so I'll let her speak more about it, Rebecca. But people leave. They've come in with headaches, they've come in all tense, and they walk out of the office totally relaxed.
Blood pressure is a little complicated because some people inherit hypertension, and hypnosis can help to some extent to the degree that tension raises blood pressure. Whether they can get it into the normal range, maybe. It depends on whether or not there are other factors that are supporting the hypertension. What I would say is that hypnosis can be very helpful at reducing physical tension, and sometimes that can have a dramatic effect on blood pressure. I teach, as I said, I teach meditation, and many times people, simply by learning to get into that relaxed state that approaches hypnosis but isn't quite there, can lower blood pressure, and those who are on a low dose of medication sometimes can do without it altogether. Hypnosis can take that further.
Do you believe that there is actually more depression these days, or are we just better at measuring it?
That's a really interesting question.
I think it's probably both.
I certainly agree. I also think that there are factors that promote overall resilience and psychological and physical health that have been altered. in such a way that I think depression may occur more frequently. One of those factors has to do with close relationships with other people. You know, people used to live in the same village or town, and you had your family all around you and friends who'd known you and your family for generations. That sense of being connected and belonging to a community, whether it's a religious community or a social community, is really important for overall psychological well-being for every human being. I mean, there are obvious exceptions. There are loners in the world, but for most of us, we're hardwired to do our best when we're connected. And so factors that cause people to feel alienated, separate from others, either geographically or psychologically, can make people much more vulnerable to clinical depression. And I have to say, over-involvement with social media is associated with higher levels of depression, and that's true even among teenagers. There is an implication that not having these connections and feeling that you're meaningful in some way and connected is hard on our immune system. It's very costly for our immune system to feel alone and that we have no purpose in life. And one of the things that helps us feel connected is visual and auditory and physical contact. It's not enough to be reading words or even talking on a phone. Human touch, just even one hand on another, a hand on the shoulder, has a tremendous impact, positive impact on the immune system.
I had another listener question, which I wasn't going to ask, but I wanted to know the answer, so I'm going to ask. She said that she heard that hypnosis can help a person get rid of warts. Is that true?
Yes.
It is.
It certainly can be.
I've seen it with eczema. I haven't had a client with warts, but I've seen it with eczema, and it's decreased the eczema.
No kidding.
Yes.
The skin is, I think, the largest organ in the body.
That's right.
And the stress responses in the skin are very common. People who have eczema and psoriasis, I've heard them say often, you know what, when I'm stressed, it's worse. And the fact of there are warts that can be treated with hypnosis and can actually disappear over time.
To me, it seems like one of the toughest things for you, please correct me if I'm wrong, would be just legitimacy in a lot of people's minds. Because, again, it's all about the circus act and the stage and the performer. Overcoming that's got to be tough.
It is.
Is that really a tough road to hoe for you guys?
It is. And in terms of the general public, I'm so glad that you are doing this podcast, because one of the basic problems is a lack of education. People are used to the stereotypes, which certainly exist, but what they don't realize is that hypnosis is a way of utilizing the powers of the mind that we already have, but that we don't know how to use. So you can't say to yourself, I would like my heart rate to slow right now. But with hypnosis, you can get into a relaxed state and imagine that your heart rate is slowing, and many times it does. One thing I like to say to people is that advertisers and others are manipulating your awareness all the time. Take control of what they're doing and how they're doing it so you can use this power for yourself, instead of allowing people like advertisers to manipulate your perception. You take charge of using your own perception to make change for yourself.
Either one of you can start with this. Basically, what do you like most about what you do?
The fact that people get so much out of it, and that they leave and you've given them something. Even if you don't always know, or they always know exactly what it is, they feel like they have a sense of empowerment. Because Rebecca mentioned that it's the power, the incredible power of the unconscious mind, and let them see, I'm just kind of your guide. I'm tapping into all your strengths and talents and skills, which are unique to you. And so that's the greatest gift, is to see people feel better.
The word gift is important. I remember one of my colleagues in hypnosis I respect very much says, this was a gift. Learning to use hypnosis was a gift that was given to me. And you say to your client, now I'm going to give it to you. It's something that people can learn to use for the rest of their lives in many different ways on their own. I mean, they can be taught. But once you know what the deeper levels of mind can help you accomplish, suddenly a lot of things seem possible in life that may have looked impossible before because you didn't think you could do it, or we limit ourselves with the picture we have of who we are and what we've always done. Hypnosis opens the world of possibility to seeing ourselves in ways we may never have thought was possible before. We could be more than we are using all of our minds. And that is a huge reward for me. Specifically, I have seen people who suffer chronic pain all the time. And if they're good subjects for hypnosis, meaning if they're able to use it, can really tolerate very serious pain, can learn to manage more effectively every day, and for some people use fewer pain medications because they can manage some of it on their own.
What about the flip side of the coin? What are the most frustrating part of it?
Well, I think, like everybody, we all want the quick fix, and hypnosis can be it can be quick, but, for most things, it's not that simple, and it's complicated, and like any therapy, psychotherapy, hypnosis, people just have to learn to have a little patience sometimes and recognize that it took this long to get there. It's going to take a little bit of time, depending on the complexity. There are situations where 1 or 2 visits, it does work, it's effective immediately, but more than not, it's more than that. And so I think the frustrating piece is it's just going to take a little bit of time, and just being with it. But if you hang in there, it can work.
I agree with you. Perception.
Yeah.
On the part of someone coming in who thinks it's an instant cure. Mm-hmm. It's like the magic bullet. You suddenly take over my mind and fix this the way a surgeon would take out something you don't need. And there's no effort on the part of the client. If you're changing a habit, there's going to be some work involved. If you're changing something else that you've been doing for a long time, it's not instant. People come in and they say, for weight reduction, they say, I want you to hypnotize me so that all the food I shouldn't eat tastes terrible.
You can't do that?
Well, let's put it this way. You really wouldn't want to lose the pleasure of good food. So yes, impatience, yes. And I think that comes from a lack of understanding of what it is. Yeah. I don't like to disappoint people, but sometimes they end up being disappointed if they think this is the magic wand.
What type of person, or when should a person consider using hypnotherapy?
It can be very helpful for habit control and change. So when you're stuck in a stubborn habit and you think, I've tried everything, I really need some help with this. Going to see a mental health professional who can use hypnosis as a tool in the context of other tools usually. I think it can be helpful for so many different situations where we want change but we can't imagine being different. Where you want to improve your health but you can't motivate yourself to do it. Because hypnosis allows us to envision ourselves as we could be, as we might be. And not doing things that are actually impossible for us, but to begin to envision what would we be doing if we weren't so afraid. I sometimes use the example of someone who's been given a Ferrari as a gift and doesn't know much about race cars and only uses it to go to the grocery store and to work. And finally someone comes along and says, have you ever tried opening that car up on a long, empty road? Wait till you see what that's like. So when people feel stuck, they can't imagine themselves doing anything differently. Hypnosis is a great thing to think about.
Thanks, Darlene and Rebecca, for joining me today on Body Talk. Finally, the next time you bite off more than you can handle in regard to a hot chili pepper, your best bet is to drink some milk. That's according to research conducted by New Mexico State University's Chili Pepper Institute. It turns out that milk has a protein in it that replaces the hot spice on the receptors on your tongue. Researchers say it's really the quickest way to alleviate that burning feeling. Their research was published in the British Medical Journal. Well, that's it for this edition of Body Talk. My producer is Katie Stell. The Body Talk theme song was composed by Rob Carlson and sung by Vicky Vox. If you'd like to stay up with medical studies on a daily basis, follow me on Twitter at BGPVideo. And if you have any questions or comments about this program, feel free to send me an email at lifestarmedia@gmail.com. Body Talk is a production of Lifestar Media.